A young heart doesn't always mean a healthy heart. Cardiomyopathy is any disease of the myocardium or the heart muscle causing it to weaken. And unfortunately, due to congenital factors, one of our most vulnerable populations can be affected. Our children. A child with hypertrophic cardiomyopathy may present totally fine until they don't. And that's why it's so important to recognize subtle signs that they may present with. If it's left undetected, it can lead to harmful arrhythmias, heart failure, and even sudden cardiac arrest. And in emergency medical services education, we're taught about congenital cardiac conditions, but not nearly enough. And recognizing some of the subtle signs that children may present with could make a life-saving difference. Some of those signs and symptoms can be near fainting or fainting episodes, extreme fatigue and weakness with or without activity, chest pain or palpitation, and shortness of breath even at rest. So what can we do as EMS providers in the pre-hospital setting? First thing we can do, don't dismiss the symptoms for a growth spurt or dehydration or something benign. Take them seriously. The next thing that we can do, get the ECG. Oftentimes irregular heart rhythms or an abnormal ECG is the first diagnostic clue. Ask about family history. Oftentimes cardiomyopathy runs in families and even within siblings. Is there anything that can be done on a larger scale? Absolutely yes. Making sure that there are plenty of AEDs all over the schools and sports areas, training facilities, etc. Another thing that you can do is to get with your local medical providers and see about getting regular health screenings for your youth population, especially ECGs. An example of something like this is Heart Charged. Heart Charged is a Miami nonprofit organization that has managed to have thousands of students get free ECGs and screenings to detect cardiomyopathy early. So you might ask, who would run an organization like this? How about Hannah and Bethany, two sisters who unfortunately both suffer from hypertrophic cardiomyopathy, but have used their unfortunate experience to save lives and have organized these mass health screenings for the youth of Miami. So we partnered up with the hopes of raising awareness of childhood cardiomyopathy. Remember, a simple assessment and ECG could save a life.